everyone, welcome. I'm here with my colleague Wanja Nyaga. I am Helena Trigueiro. We are both nutritionists, and we will be here to talk about recognizing nutrition deficiencies and the way to identify these deficiencies, not only by eyesight, but also by a physical evaluation. So I will start by talking about micronutrients and water-soluble vitamins deficiencies. So, and then Wandra will follow up with other deficiencies you can find and identify. Talking about micronutrient deficiency, where in the body can we see that this can be very easy to identify? Well, usually is in places where fat tends to accumulate. So, for example, in the back ribs, in the clavicle, and the temples, but also where the muscle tends to accumulate. You will see that by looking at an individual, for example, the fat pads under the eye. If you see that the individual has a very thin skin, very thin skin fold, not only in the fat pads under the eye, but in the tricep, in the bicep, we will see that this means usually he is malnourished, he or she are malnourished. And this can happen for various reasons, but we must be acknowledging the symptoms. And also another thing I ask you to be sensible is the ankles, because usually edema is a consequence of malnourishing. So the person will get some swollen appearance in the ankles, so this means that there is probably some edema going on. Regarding some micronutrient deficiency that we will find not only in energy, but also in carbohydrates or protein, I'll bring you two cases, kwashiorkor and marasmus. So starting with kwashiorkor, we feel and we see that this happens usually in preschool children, 1 to 5 years of age. And this is the main cause is due to low protein intake. So this is not due just to energetic deficiency or low calorie intake. That may not even happen, but it's especially due to low protein intake. This causes some growth retardation. This causes reduction in the weight, and you can identify these children, these individuals, because they have a very swollen appearance belly. See in the image, it's as if they have a protruding abdomen. It looks like it's fat, but it's not. It's just edema. So you don't see the ribs because everything is very swollen. They usually have an enlarged fatty liver. They have moon facies, which is the face gets swollen and very such as if it was chubby appearance, but it's not fat, it's the edema. And they become very lethargic, very slow in their movement and their actions because of the deficiency they have. Marasmus, on the other hand, is different. Marasmus happens usually on infants younger than 1 year old and usually due to low calorie intake. So this is where the malnourishing is due to low energy. There's a severe growth, a severe reduction in body weight. We see that the abdomen shrinks and we can see the ribs very clearly. There is no fatty liver whatsoever. There's no edema. And the children become very irritable. So they don't get lethargic at all. They get very hungry and angry as well. This means they not only require adequate amounts of protein, such as kwashiorkor, but also require certain and right amounts of protein, fat, and carbohydrates. So this is really an energy problem. Talking about biotin deficiency, so regarding biotin, we see that the main way it showcases is usually in the hair and the nails. For example, you can see in an individual with biotin deficiency, B7 vitamin, we will see very dry and brittle nails. And the hair, we can identify some spots where the hair decays, where there is some bald spots in the head. And this happens not only in males, but also in females. And we will see that it's as if it's getting bald in certain spots, and this can be caused by this deficiency in particular. Regarding thiamine deficiency, vitamin B1, what we know is that this deficiency usually showcases in in a dermatitis way. So it's in the skin. It looks like a rash. You can see it looks like the person has a severe allergic reaction or something, but it's not. It's just these red spots all over the body, and it's because of B1 deficiency in particular. So it's important to be aware of this and the way it can be translated to different skin tones. So for example, in a brownish skin tone, it will not be that red. It will be more of an orangey color, the spots, but it's important to notice them. Regarding riboflavin B2 deficiency, we can see that this deficiency usually has consequences in the mouth area, not only in the tongue, because the tongue gets really pink, swollen, very magenta-like, but also in a condition called chelosis, which happens in the lips. So this happens in the lips with some cuts in the lips and some abrasure looking in the mouth area. The mouth looks very dehydrated. It looks like it has some open wounds. It really has some open wounds and severe cuts. And usually this can manifest in either or both ways. And sometimes the chelosis is also because of the swollen of the mouth, of the tongue, and allows this humidity to cause the wounds. Regarding niacin, vitamin B3 deficiency, this manifests in multiple ways. We can talk about the way that it manifests, such as if it was a necklace. We look about this this necklace appearance, very pellagra, called pellagra appearance, where it's really because of vitamin B3 niacin deficiency, and also showcasing on the hands and the feet. So the hands and the feet get very swollen, very red, skin is flaking, looks as if they were burned. Also in the tongue gets very brain-like, very whitish, very swollen, and we can see there's a deterioration of the gustative palate. So we understand that there's a problem in the area, and unlike the other condition, the tongue is not pink, is very whitish. So this is not B2, this is B3 deficiency. I will now hand over to my colleague Wanja Nyaga, and she will talk about vitamins A, D, E, and K, and elements and minerals deficiency. Thank you. Welcome, Wanja.
Thank you, Helena. Hi, everyone. My name is Wanja Nyaga, and I'll be sharing with you on vitamin A, D, E, K, and other mineral deficiency. Next slide. So, vitamins A, D, E, and K are also known as fat-soluble vitamins, and they tend to be stored in the body for a long period of time. The deficiencies of these vitamins can manifest as follows. For vitamin A, you mostly have night blindness, or what we call the detox spot. For vitamin D, we'll tend to have rickets, mainly in children, or osteomalacia, which is the softening of bones. For vitamin A deficiencies, you tend to have more oxidative stress, which means the mechanisms in the way the body is working are slowed down. And for vitamin K deficiencies, most of the time patients will present with hemorrhage, which is excessive bleeding. Next slide, please. So this is just an example of the beta spots in vitamin A deficiency. You can see close to the eye, there's a whitish spot on both eyes. So that's what happens when you tend to have vitamin A deficiency over longer periods of time. Next slide. So for elements and minerals, we mainly have minerals as inorganic substances that the body needs in very small amounts to be able to function in a normal way. And the main ones include calcium, iron, magnesium, potassium, zinc, iodine, and folate. Of all the minerals, the most common one the most common deficiency happens to be the iron deficiency, which leads to anemia in most cases. And according to the WHO statistics, in 2019, at least 29.9% of women in the childbearing age did suffer from anemia. Next slide. So the causes of this deficiency, the first and foremost is inadequate dietary intake. So when you have over long periods of time, if you have foods that consist less of what you need daily for your vitamin A, D, E, K, or mineral intake, then you'll tend to have a deficiency long term. Also, because we've already identified that vitamins A, D, E, and K are fat soluble, it means that we need fats in the diet for them to be able to be absorbed fully. So if your diet has less of fat, it means that interferes with the absorption of those vitamins. And the other could be disorders, for example, the malabsorption disorders, which interferes with how the minerals and the vitamins are absorbed by the body. We also have the drugs like mineral oils, which also prevent the optimal absorption of vitamins or minerals. At times, we also have nutrient to nutrient interaction. For example, you could have calcium and iron, and one of them has the body has a higher affinity for one of the nutrients, so it tends to absorb one nutrient more than the other. So in that case, if you have a food or a meal that consists of both iron and calcium, then your body will tend to absorb one more than the other. Same goes for drug and nutrient interaction. If you're maybe down with some sickness and you have to take some medicine, at times it could mean that if you have a meal and then you have your medicine, there's a possibility of the drugs preventing the optimal absorption of some minerals or vitamins. Next slide. So, like my colleague Helena mentioned, we have general signs and symptoms of different deficiencies, and on this table, it's arranged according to the body region. So we have the skin, we have nails, we have the head or the hair, the eyes, the oral cavity, which involves the mouth and the tongue, and we also have the nervous system. So basically, when you look at the skin, there's I'll just quickly highlight a few things. So we have vitamin A, like we said, um, you tend to have poor night vision, or when it's very advanced, then you tend to have the beetle spot. If you look at zinc, will tend to have photophobia, which means it's light. The eyes are not able to adjust to light as they should because your body lacks enough zinc. If you look at iron, which is the most common, like we said, will tend to have anemia, and that goes from children to childbearing women as well as men. But the most people in the population affected by iron deficiency tend to be children below 5 years and women in the childbearing age, which is 15 to 49 years. Next slide, please. So, like again, my colleague said, the diagnosis of these deficiencies can range from physical examination to signs and symptoms and also routine blood tests. So we have medical history, which is determined through a series of tests and as well as family history of diseases, physical examination at your doctor's, and also the review of the diet that a patient has been eating over time, which is carried out through various dietary methods. And then we also have other tests to identify underlying conditions. And in this case, for example, if I could just talk about maybe a disease like cancer, it's likely to cause deficiency, or it's likely to affect the body in how it uptakes nutrients. So in that way, if a patient is suffering from cancer, then it's likely that they will, if it's not if it's not detected early, then it's likely they will be having some deficiencies. Next slide, please. So for the treatment of these deficiencies, we mainly have three broad ways to go about it. And the first, and I would call it the easiest, is improving the diet of the people who present with these deficiencies. So that could be, for example, if it's vitamin A, D, E, and K, we need to look at if the food that they're eating has enough fats, so that then if they eat the food rich in vitamin A, D, E, and K, the body is able to optimally use the vitamins. And we also need to look at supplementation, although this is very, it has to be regulated and it has to be suggested by a GP, a doctor, or a nutritionist. And the reason why is because, just a quick example, for vitamin A, it's not advised to be supplemented in pregnant women, especially in the first trimester, because it has adverse conditions on the growth of the fetus. So if a pregnant woman is deficient in vitamin A and they are on the first trimester, then they need to talk to the doctor so that they're able to go about that without the supplements. And if they're able to use the diet to increase their optimal intake, then it would be best. And for situations where it's severe, for example, you could be having a person who has anemia and they need definitely their hemoglobin count is low. So they'll need something like a transfusion, which is considered an emergency treatment to help in managing a deficiency. Again, just like my colleague said, most of these research studies or the photos that you've seen, they do show symptoms as they appear on white skin, while in reality they may appear different in people with black or brown skin. Next slide, please. There's just quick references and a few questions for you to think through and see what you've learned from the presentation. Hope you enjoyed it. Thank you.